Hello, my name is Bianca.
I'm Amy.
And I'm Elisha.
And today we will be talking about HALO, a quantitative pain assessment device designed to objectively detect pain in geriatric patients with progressive dementia.
Approximately 63.5% of older adults with cognitive impairment experience bothersome pain. However, conditions such as dementia and Alzheimer's disease often limit a patient's ability to communicate discomfort. As a result, pain is frequently expressed through behaviors such as agitation, aggression, or wandering, making it difficult for clinicians to distinguish pain from dementia-related symptoms.
Current clinical practices rely heavily on the hierarchy of pain assessment. This approach uses self-report scales when possible, caregiver observations, and often an analgesic trial to determine whether pain is present. While all approaches can be useful, they remain largely subjective and time-intensive.
Another commonly used method is the Assessment of Discomfort in Dementia, or ADD protocol. This framework evaluates behavioral changes in caregiver observations, but still depends on subjective interpretation and trial and error approaches to pain management, such as analgesic trials.
Based on these limitations, we identified a clear need. Providers caring for geriatric patients with impaired communication require an objective quantitative tool to identify and manage pain more accurately and effectively. To address this problem, we created HALO, a wearable live pain assessor that utilizes biometrics extracted from EDA, ECG, and EMG signals to diagnose pain. A complex machine learning model constructed through the weighted blend of neural networks and decision trees was trained on public pain databases. Following model optimization, low-SO cross-validation was utilized to determine the accuracy of the model's data predictions, returning an AUC of 0.72, limited only by the constraints of available datasets. Biometrics fed through the model produce a pain level index, or PLI, that quantifies pain on a scale from 0 to 100, with 0 to 25 being little to mild, 26 to 64 being moderate, and 65 to 100 being intense pain. This data is then transmitted to an application where nurses can monitor patients' pain levels and coordinate treatment.
When comparing existing technologies, significant white space can be seen in the upper left quadrant for low-priced, high biometric integration devices. It's also important to note here that most devices listed are primarily used in the operating room and are not built for at-home applications. Considering this, HALO is positioned in a unique space by combining high biometric integration with a lower-cost design suitable for home health settings.
From a regulatory perspective, HALO is expected to follow a Class 2 510K pathway by leveraging physiological inputs such as heart rate, skin conductance, and muscle activity. We believe a predicate-based pathway may be feasible.
Thank you.